going to talk about willpower and the amount of treatment somebody should have based on their life and their the amount of willpower they have when they show up for your work. So I'm looking at a couple of analogies. One is Sally. I got that from Leon Scheitau, and the other one I've known it for like 20 years. I'm not sure where it came from. So somebody smarter than me. And so what I'm going to talk about is willpower first. And in the 70s and then later on, actually, they repeated it. There was a marshmallow experiment. And they did a marshmallow experiment with children. And so what they did was they gave child marshmallow. And they said, okay, they put this marshmallow in front of the kid. And they go, okay, if you don't eat this marshmallow for 2 minutes, we're going to come back in this room and we're going to give you 2 marshmallows. And very few kids made it 2 minutes to get the second marshmallow, but some did. And then they said, okay, well, those kids who could hold out and just get and hold out and get just 2 marshmallows, now those kids have greater willpower. And they followed those kids throughout their lives, and they found that those kids were leaders in school. They were more successful. They were more successful at work and family and everything they did. And willpower is a bigger measurement of success than IQ. And willpower is actually a tougher thing to develop more so than IQ. You can develop your intelligence much easier. And some people think that, whatever you're born with willpower, and that's what you have for the rest of your life. I don't agree with that. But willpower is the ability to persevere through something that you don't really want to do based on the goals at the end. But it takes mental energy. And so willpower works like this. And you only have so much of it to get through the day. And so this is your willpower line. So that's 100 and that's 0, right? 50, 75, and a 25. And now if you take this and turn this into money, like there's $1 and that's 75 cents, 50 cents, 25, and then 0 is your flat broke. And so say you've got $1 and $1's worth of willpower to spend today, right? And so what happens in the real life is thinking about the past, bringing the past into your present eats your willpower. And so you've got this person here who, let me change colors for you. So you've got this person who, this woman, say it's a woman, she gets out of bed in the morning, and before she wakes up, she thinks about, oh, my ex-husband, oh, my dad, or I never really got to finish school, or I never succeeded in anything I really wanted to do because, I did something, whatever. And so she's throwing, probably, that leaves her 60 cents. She's throwing 40 cents worth of her willpower away to the past before she even gets out of bed. Thinking about what could have happened, what should have happened, all of that. Living in the past, throwing it away, right? That's her mental energy. And so now she's got 60 cents worth of willpower. So then she goes and she gets in the shower and she starts thinking about like, well, I got to do this at work today. I've got this stuff to do. I've got family chores. I got this and that. And so she's thinking about all the stuff she has to do today before she even gets out of the shower, right? And now I'll say she's got, 40 cents left because she's burning her willpower thinking about this stuff. Maybe her back hurts. Maybe her neck hurts, right? Pain eats your willpower. So her neck pain, she can't rotate her head, it hurts. And now she's at 30 cents for today. Oh, but the kids need to get ready for school. So she's got to get her kids ready to school, get them out of the house, and get them fed, and make sure they got all their stuff to go to school. And, they're putting up a fight because they don't want to go to school. And now she's got 20 cents of willpower because, the kids take it up like this right there. And so then she's like, well, God dang it, I need to exercise because I'm so out of shape and stuff. But exercise takes willpower, and it does eat some of you. So she does a little bit of a HIIT workout or something right here. It makes her feel a little better, but it does take some willpower. And so now she gets in the car and goes to work. But now, as she goes to work, she has got 10 cents worth of willpower left to spend on her entire day before she gets home. And what do you think cooking dinner does to her and getting the kids ready for bed and all that? By the time she gets into bed, she is flat broke. Okay? And that's how willpower works. You're not going to get more willpower through the day. What you can do is maybe manage this one right here and not throw your mental energy into the past. And I believe really the results, one of the biggest results we're getting from the neural reset is to think about your past question. And what that does is I believe it alleviates this section of willpower. Your body isn't tightening up or going into fight or flight or anything while you're thinking about the past. So I think that's why that result is so good. Is I think we're actually getting people more willpower to get them through the day. Okay, and so now we're going to talk about Leon Scheitau's Sally. And okay, so these people are your patients. You may know somebody like that person I just described. That may strike a chord. Okay. Now we got Sally, okay? So here's Sally. An innocent young woman in her mid, maybe early 30s. So this is Leon Scheitau's Sally. Okay, so let's say we're just making stuff up here. We just imagine this is a real person, okay? So Sally has got a 10-month-old baby. And say, oh, she's got a 4-year-old. Okay, so she's got these 2 kids on top of her. And she's caring for these kids. She has no family close by. She has extended family. She's got an extended family. And that's on top of her because they're always talking, they're always calling, always talking to her, telling about their problems. She's like the kind of the problem solver for them. She's got her husband, but he's off at work trying to support everybody his own way. But she's also caretaking her husband. She's kind of caretaking those people. She's caretaking her children. And then over here, oh, she's got a friend. And maybe her friend is going through a divorce. And she really wants to be there, because this friend was there for her. And so that's getting on her. Then she has to take care of the household. She's got to cook. She's got to do all the shopping because her husband's always at work. Oh, and the 4-year-old, this guy here has strep. He's got strep throat. And now he's got to go to the doctor. So Sally puts the 4-year-old in the car, and that 4-year-old just pukes right down Sally's shirt. Now she's got to go clean him up before they get in the car. Oh, and before they can get in the car again, this kid takes a big poop in the diaper, and now she's got to change the diaper and all this before she can just take this kid to the doctor to get some medicine for the strep, and then the antibiotics is messing up this kid's gut, and it's all messed up. And so also, Sally, average American, is on a standard American diet. That's on top of her, and that's causing inflammation. That's inflammation right there on top of her. And she's trying to exercise because she's trying to stay in shape. That's on top of her too. She's really trying to exercise. And so she's cooking, she's got house stuff, she's got to do the shopping, and all of this is on Sally, and Sally doesn't have much help elsewhere. And she's trying to organize play dates for the kids because kids need socialization. So I got to get a play date. And it's like, oh, I got to get them there on time. Can we do that? That's all on top of Sally. Okay. So that's pretty average. Things that you won't recognize in Sally. Sally is in pain. She has back pain. She has neck pain. And needless to say, Sally has no sleep. She has not slept in how many years? 4 years. Lack of sleep. So she hasn't slept in 4 years, right? And this is her pains are on top of her. And she seems like she's getting some endometriosis and some other woe things that are going on. She can't figure out. And you're going to see this in your patients. So say she's got endometriosis and she can't figure out why the hell she's getting sick, and she can't digest. She's got like, man, my stomach hurts. She can't digest because she's got so much stress. She can't make hydrochloric acid. Okay, so there's enough stuff. So that's, maybe you know a person like that. I don't know. So now Sally is your patient, and Sally comes in. And you look at Sally and go, okay, this is a mom. She's been carrying a baby. Her shoulder hurts. She's got neck pain. She's got mid-back pain. Low back's kind of out a little bit. Now, you look at her, you do the evaluation. Oh, that's a bowling ball syndrome. She's got an uneven, her eyes uneven, her head's uneven, her shoulders are uneven, her hips are uneven, and she's weighted on one foot, which is typical of carrying babies. And that's called bowling ball syndrome, Boyd's bowling ball syndrome. And it's like, okay, I got this. Oh, you test her, she's sympathetic dominant, you got a breathing pattern disorder, and your liver's stuck, it's not moving, your spleen's stuck, your stomach's stuck, and I'm going to do visceral work, I'm going to do breathing, I'm going to fix your cranium, I'm going to fix your shoulder, I'm going to make you rotate because your ribs are all stuck, I'm going to fix your sympathetic dominance, and I'm going to do all that. And so what you do, being an excited person to see, like, I got solutions for all this stuff. Let me put a different color. You add treatments. So they see a treatment and you add 4 modalities in your 90-minute treatments. And you do 4 things on top of Sally. Okay. And then Sally's like, okay, because she's game, she really wants to do it, because she wants to get better. And then say, okay, well, I got exercises because I got, some serious, I'm going to get you breathing. Here's some spinal rotation stuff. Here, use this lacrosse ball on all your trigger points. We're going to do that. Here's a liver twist modality. And so you throw on, and she's got 1, 2, 3, 4 homeworks, and you did 1, 2, 3, 4 different things during your treatment. And Sally goes home and she collapses on the couch, and you killed Sally. You killed Sally. Okay, so don't kill Sally. Okay, so that's the point. Somebody may know somebody like Sally, and Sally may be one of your patients or all of your patients. So how can we not kill Sally? Because Sally has a finite amount of willpower. She can only take so much in a day, right? And so you can't remove all this stuff. You want to say, I just want to fix your diet, just get off that. That's a stressor. Do not add stressors. If you change somebody's diet, you're adding a stressor, right? And so only do like 1 or 2 things. How about let's get rid of that exercise? Yeah, she's got Boyd's bowling ball syndrome, and she's all twisted up. But is she really going to do that homework? Probably not. Okay, so let's give her 1 exercise, and let's make it easy. Let's say, okay, you're going to do like a breathing. You're going to do it in your car while you're driving. Wherever. So just a little bit. Let's get a little diaphragm. Let's get rid of anything difficult as far as on the table treatments go. And let's just do 1 thing. Let's do 1 thing, and let's make sure that it's relaxing. Make sure it's not too demanding to Sally to do. So I'm going to give her 1 thing. I'm going to give her this thing, and I'm going to do that. Maybe a nice, relaxing treatment. I know that she's not fixing every one of her problems, but with somebody like Sally, who's a typical mom, what we do is like, look, when you're done carrying babies and your life is calming down, let's fix all this stuff, right? But in the meantime, it's survival mode for Sally. Don't kill Sally. And so you will see patients who have diseases, chronic diseases, maybe they have cancer, all of that stuff is a stressor upon them, right? And your treatments are a stressor. Your homework is a stressor. Don't give them books to read. They ain't gonna read it, right? That's a stressor. Now they're stressing out because they're sick when they can't have time to read this book, right? And so take it slow and be really intelligent about your treatment. It is the art and science of medicine. And we are doing physical medicine. Let's not like pretend that we're not. This is pretty serious stuff we're doing. And it's the art is how much treatment do we give Sally? And we don't want to like undertreat Sally, but we don't want to overtreat. So where's that line to meet a patient exactly where they're at? We've seen people in the clinic, and I've heard them complaining when they left. It was like, well, what the hell was that? They didn't even touch me, and that was undertreating, right? That guy wasted his money, wasted his time, and probably not going to come back because he's like, that was nothing, right? That's undertreating. Overtreating is the exact same thing on that other spectrum of polarity. You've got to hit them right in the middle, and you got to read the room. And if they look exhausted, don't wake them up. Don't make them do anything active. Just let them sleep on the table and just do a real nice maintenance treatment. And you know that one day, when the kids get older, things start calming down for her, we can put their body back, right? That's what I tell them. Look, there's hope in the future for this. We can help you through it. But you don't go in there and change a whole bunch of stuff and kill Sally, because that's not the kind of treatment you want on your record. Okay, so hope that's useful. And when you get in clinic, start paying attention, and when you shadow, start paying attention like to how much modalities do we do and how much we throw at it. All right, so that's part of the art and science of medicine. All right, don't kill Sally.